You're locked in to the hottest station on the planet.
Resistance is futile. The revolution has begun.
You're listening to Rebelpreneur Radio, helping you break the rules and build the business you need for the life you want. And now, broadcasting his pirate signal
from somewhere beyond the status quo,
here's your host, best-selling author, marketing and media strategist, Ralph Brogden.
Hello and welcome to Rebelpreneur Radio, the show that helps you build the business you need so you can live the life you want. I'm Ralph Brogden. Well, you know, building the business you need for the life you want, it doesn't just apply to the ordinary businesses that you think about. It also applies to medical businesses, medical practices, doctors. Believe it or not, they do want to help people, but they also need to build a business that supports the life that they want so that they can keep helping people. And so there are very gifted people in the world whose mission is to help these doctors build the business or build the practice they need so they can live the life they want and do good and help other people. I've got one of those individuals, one of those professionals here with me today. His name is Dr. Mark Sanna, and he is a health care entrepreneur. He's built several successful businesses helping medical professionals and alternative healthcare providers break down the walls of the traditional silos that hamper effective collaboration. Dr. Sanna has helped providers form integrated healthcare teams and networks, not just in the U.S., but internationally. So it's my pleasure to have Dr. Mark Sanna on. Welcome to Rebelpreneur Radio.
Ralph, thank you so much. I'm glad to be your guest today.
It's a pleasure to have you. And we were just talking about how the big Arctic blast is pulverizing the northern United States and Canada. You're joining us from sunny Miami, Florida.
Well, that's right. And it's a bit chilly down here. I think it may hit 70 today. So we're wearing our parkas and our mittens as well.
Yeah, that's a tough life down there. I'm telling you what, 70 degrees. Hopefully you will survive and you'll get through this okay. You are a healthcare entrepreneur. Tell us a little bit about your journey through healthcare. And then what got you interested going beyond your personal practice and building a business that helps doctors do business better?
Well, Ralph, it's very interesting. I never sought out originally to do what I do. This has become a passion, and it really grew out of my focus of wanting to have doctors and alternative healthcare providers actually work together. They sort of were oil and water in the past and cats and dogs and didn't play very well together. And unfortunately, I think patients and healthcare as an industry at large has suffered from that. And so when I founded my company, Breakthrough Coaching, my vision was really to break down the silos, break down the walls that separate the traditional medical practice that might be more drug and surgery focused, maybe more disease focused, and those alternative practices like chiropractic and acupuncture that were really growing in recognition, growing in the evidence-based science that they began to use, and actually have them be able to work together so that patients who are interested in maybe having the best of both worlds, or at least having the choice of being able to decide, do I want to take a traditional route? Would I like to take a more alternative route? Or how about even embrace both together? That's become my life's mission, really, to have patients be able to have the very highest quality care possible.
I like that approach, and it's a good holistic approach. If we keep in mind that your goals are pretty simple. When you have someone with a pain, they want to alleviate that pain and or someone who is not healthy or they have a health challenge. They want to feel better. They want to look better, and sometimes traditional medicine just doesn't get them where they want to be, or maybe they're just more responsive or would be more responsive to alternative things, or as you say, a combination of the two.
Mm-hmm.
So, tell us a little bit more, because I would imagine that some doctors are pretty rigid. It's scientific-based, evidence-based, and they're not really into alternative medicine. So who are the ones that are embracing this that you tend to work with? And tell us a little bit about what that's like to try to get them to make that transition.
Well, Ralph, I began my career as a chiropractor over 30 years ago, and I've certainly seen a complete change in the attitude from traditional medicine toward alternative providers. When I first started, medical doctors wouldn't even play around a golf with you at the country club, and now they're embracing the alternatives that are out there in a much different way. And I do think it is patient driven. This new model of healthcare, this collaborative model of healthcare, is being driven by several forces. I think number one, for sure, patient demand. Number two, we're facing an opioid crisis right now in this country to a degree that I don't think we've ever seen anything like this before. You had 72,000 deaths this last year from opioid-related incidents, and this is a growing problem. It's a very significant concern, and it has some really important folks out there like the CDC, the Center for Disease Control's, the attorneys general, the American Academy of Physicians are all making recommendations to try more conservative alternative care before moving into a drug-based reaction. And this is something that really requires a team approach. While there's a tremendous amount of evidence out there that chiropractic and acupuncture and other alternative healthcare models are very, very successful, the likelihood is that most patients are going to enter the healthcare system by visiting their primary care provider. And so in educating primary care providers in how and when to refer to a chiropractor, we begin to break down the walls. Hey, listen, the medical docs are as frustrated with dealing with back pain and headaches, and those are the wheelhouse of chiropractors. Those are the things that chiropractors deal with day in and day out. And so if we can shift that paradigm to have patients maybe moving from the front door, maybe trying alternative providers, and especially in the multidisciplinary setting where there's a co-management of patients, where patients are referred from one provider to the other based upon their needs. But by the way, based upon who can be the best of help and assistance to that patient, it's a different game.
Wow, that's really powerful, and I imagine that's quite a paradigm shift for someone to make, because we tend to find our particular methodology. We want to stick with that, and the idea of one provider, a more traditional medical provider, referring someone to an alternative healthcare provider, and vice versa. It's kind of against what we typically hear, and I think that's what you've identified as one of the greatest challenges. The opioid crisis is a symptom of a bigger problem, and you're saying that the greatest challenge is really the fact that, for example, medical doctors and chiropractors haven't traditionally learned how to talk and to help one another, or how to communicate with one another. Tell us a little bit more about that, and how you help them to actually do that when they've not really been taught to do that.
Well, you're right. You know, the education that we receive, both chiropractors and medical doctors, are thousands of hours of coursework and clinical work and internships and residencies. And I don't think you'll see too often in a course syllabus where we're learning how to integrate with each other, how to collaborate with each other. And it's simply having a different vocabulary of how to discuss what it is that patients are experiencing, and really how to share our examination findings, our test results with each other in a collaborative way. That's a unique thing. It's not something that we're taught, and that's something in breakthrough coaching that we work with doctors every day, is how to create criteria for healthcare that we can communicate from one discipline to the other so that we're all on the same page. And I had a very personal situation occur in my life, and it really changed the way that I looked at collaboration and the importance of collaboration. And it actually happened with my own mom, Ralph. Mom was misdiagnosed with lupus, and lupus is a very, very serious autoimmune disease, and it impacts thousands of lives each year. And that's a pretty heavy diagnosis to get. And the problem with that diagnosis is the treatment it's typically prednisone, which is a very heavy-duty, strong steroid. And Mom suffered all of the classic side effects. Poor dear, she swelled up in tremendous water weight gain. She ended up having thinning of her bones that resulted in multiple vertebral fractures, tremendously painful. Gosh, I think the worst part, though, was actually her mood swings. And her mood would go from being the joyful mom that I knew to one of terror and depression and despair. And gosh, for some time, we didn't know if we were actually going to lose her. And by really great fortune, we were able to get Mom under the care of the Mayo Clinic. And the Mayo Clinic has kind of been, for me now, the model of healthcare that I've been teaching providers. When Mom went in there, they gathered up all of her past health history and shared it amongst the various providers. It was a multidisciplinary team, so there were primary care providers, there was endocrinologists, neurologists, orthopedists, had nutritionists, chiropractors working together off of the same shared medical record. We call it transparent medical record. So instead of imagine each doctor having their own chart and file on my mom, they all opened up and looked at the same chart. And this,
I mean, that sounds like common sense, but it's not necessarily common practice, is it?
That's right. And there are lots of barriers to that happening, just simply that different computer systems don't talk to each other so easily. So getting us all on the same page has some technical challenges as well as philosophical challenges. And thank goodness, because of this collaborative effect, this Mayo pinnacle of healthcare system that Mom was in, they actually realized that she was misdiagnosed with lupus. She had been, oh my goodness, on this course of prednisone for all of that time and didn't need to be. They weaned her off the prednisone. And Ralph, I'll tell you, if you met Mom today, she went from where she, no kidding, couldn't even walk across the room unassisted to now she's back out golfing. You can't even tell that Mom had the issues that she had. And that really put wind beneath my wings. Having your mom saved by this collaborative multidisciplinary team reinforced for me that I'm on the right track, that what I want for my mom, I want every single person to be able to have as a choice for their mom or their child or their spouse when something goes wrong.
Well, and that's what everybody wants for their loved ones. They want the very best care that they can get, and they want their medical team, regardless of their discipline or their focus, to talk to one another. So it's really interesting because my education is in strategic communication, and I see how communication is such a factor here. Not just philosophical differences, but actual technological barriers to doctors and medical providers being able to communicate. It's a basic problem.
Sure.
But what do we need to do to see some improvement in this area? How do we create the paradigm shift we need to give patients the highest care?
Well, this is something that we can't sit by and expect that someone else is going to do it for us. This is something we actually have to be actively involved in. So it's absolutely important for not only physicians, but for patients to speak up. Speak up to your legislators. Let people know what it is that you want to see in healthcare. And as I mentioned, Ralph, what people want is choice. They want freedom of choice in their healthcare. And of course, I believe that multidisciplinary setting, that collaborative setting, provides patients with the highest level of choice. We're starting to see this now occur for example, the Veterans Administration, where much of the opioid crisis begins with our vets coming home and getting involved in that terrible spiral of despair that can occur. Now we see in the VA greater access to alternative providers, including chiropractic, and that happened from getting active. From people making a demand for it. So let your employer know when they're selecting benefits for you. Let the insurers know. Let the legislators know what you want. It's an interesting thing. There's quite a lot of studies shown that people would access to a greater level alternative providers and even multidisciplinary settings if the barrier to entry was less. Listen, the reason why an opioid or even a non-opioid medicine is prescribed is it's cheap. It's inexpensive. It certainly costs less than a doctor's office visit, but the results are devastating. 72,000 people dying in a year and increasing year after year after year. So for me, it's systemic. I'd like to see a lowering of deductibles or a waiver of deductibles and co-payments when patients select an alternative provider that is evidence-based, that is going to provide them with more cost-effective, efficient, and affordable care than if they were to maybe access the healthcare system through a specialist or through a PCP who's going to do a whole lot of extra special testing and build that bill way up and waste a lot of our healthcare dollars. And for me, healthcare reform isn't just insurance reform. It's a matter of really changing the paradigm. And I've always said that good health comes from good habits. And, in a multidisciplinary setting, if I've got a team of doctors and they're looking at my health as an aspect of my lifestyle, right? And they take that lifestyle approach to managing illness, disease, and actually maybe even raising my performance to peak levels of performance, they're going to look at me as a patient, as a partner in healthcare, and I'm not just a cog in the system, that I am important, that my voice is important, and it deserves to be heard.
Yeah, that's a really powerful paradigm shift that you're right. It goes beyond healthcare reform, or it goes beyond insurance reform. Mm-hmm. And that's the big national conversation right now. What are we going to do about healthcare, and what's the status of the Affordable Healthcare Act? And, how do we bring premiums, make it affordable? And everyone's got different solutions, but you're talking about a paradigm shift that goes beyond just insurance, and it's more about the health care system itself and the very mindset that we bring and that providers bring to the market.
Yes, absolutely.
So you work with doctors to teach them how to make this mindset shift and how to transition over into a more collaborative setting. Tell us a little bit more about if they work with you, what is going to be the outcome that they get by working with you and making this paradigm shift with your assistance?
Well, Ralph, for over 25 years now, I've been teaching doctors how to create these collaborative multidisciplinary practices. And I was very fortunate about 15 years ago to be invited by the American Chiropractic Association to actually help establish the guidelines of how physicians can work and collaborate together better in a multidisciplinary setting. And Ralph, change is on the horizon. It makes me very excited. I'll give you a quick example. Just a week from today, I've been invited to speak at a groundbreaking event in Atlantic City, New Jersey. And I've never experienced anything like this before. It's an inaugural event, first time ever, where medical doctors, orthopedists, neurologists, primary care docs, and chiropractors, physical therapists, acupuncturists are coming together in the New Jersey Doctor Patient Alliance, the NJDPA. And they are going to focus on helping patients have better choice in the state of New Jersey. And we spoke about this opioid epidemic. New Jersey is a significant issue. Their deaths due to opioid abuse increased by 24% over last year. And wow. So I'm going to help these doctors in New Jersey come together to help solve the crisis that's in their state. And this movement is going to continue to grow and spread across the country as we begin to empower patients to have greater freedom to access the healthcare providers that they choose.
I'm curious to ask if this is an issue that's only in the United States. How do other countries, say countries in Europe or just outside of the United States, do they have a more collaborative, multidisciplinary approach to healthcare, or are they basically struggling with the same things that we're struggling with?
Well, I am so glad you asked that, because I just returned from South Korea. Now, I never thought that I would be working or teaching in South Korea. I was invited there by a group of doctors. These are medical neurologists. And what they see happening in South Korea is that it is illegal for these alternative providers like chiropractors to work outside of a medical clinic, and they're standing up to it. South Korea is one of the most modern countries in the world, and yet their healthcare system has not yet evolved past what would really be 30 years ago here in the United States. So this movement is growing and growing across the world. A couple of weeks, the Great World Conference of Chiropractic is going to take place in Berlin. And the focus there, again, is on collaboration, on working together to help solve these problems. So I'm glad to say that in the U.S. we are the trendsetter. We are bringing things forward. Certainly, there are other models out there for us to learn from, and for them to learn from us as well. But it's certainly a top of the mind consciousness issue for healthcare legislators and healthcare providers across the world today.
You are the CEO of Breakthrough Coaching. Tell us a little bit about what you do in terms of consulting services for doctors who are interested in creating this multidisciplinary collaborative approach.
Well, Ralph, we provide consulting services for both chiropractors, medical doctors, physical therapists, and who are interested in creating a multidisciplinary practice. And I have a team of coaches across the country, and we work with doctors on a one-on-one basis to help make sure that we're addressing their highest level of priority. We help doctors be compliant in their practices with documentation and coding issues that are fairly complex right now. We help them hire and manage and retain their staff. We make sure that their practices are managed efficiently, and also that they consistently grow by attracting a greater level of patients who are interested in a drug-free approach to health. We do this coaching one-on-one with doctors, usually via phone or video conference, and those calls are on a weekly basis. And we work very closely with the doctors and their teams to make sure that everyone within their multidisciplinary practices is working on the same page. It's very congruent with the model that we teach for the folks who are not working in practice together. If they're in the practice under the same roof, we sure want to make sure that things are absolutely transparent in our communication about patient care. In addition, we put on 4 great events each year. There's symposium, and they're there for training, for learning, for building community. Listen, when you're a healthcare provider, when you're an independent physician, it's often easy to become an island, and you kind of feel like you're alone and it's you against the world. And it's great to come together with hundreds of doctors who are like-minded and who are really focused and passionate about making a change. We come together 4 times a year. Our next one's coming up in Dallas in a couple of weeks. And we'll certainly invite your audience to come and check out where we're going to be to learn a little bit more about Breakthrough Coaching. If it's okay, I'll let folks know my website is mybreakthrough.com. That's mybreakthrough.com, mybreakthrough.com, and you can learn about our company and our services, and certainly you can reach out and contact us, and love to see you at one of our seminars.
Well, this is really exciting, and it does represent a paradigm shift. I think that it's in the best interest of patients. If you're listening to this, that you begin to ask for these alternatives and don't just accept things the way they are, but to let your desires be known, your freedom to choose, as well as medical professionals who are listening, that they want to begin this more collaborative, multidisciplinary approach, because what it's all about is helping people get better, however, wherever, whatever it takes, doing what's in the best interests of patient care. So it's exciting. It has lots of promise. And Dr. Mark Sanna, I appreciate your time on the show today to help walk us through this transformation. Any final thoughts or words of wisdom you'd like to share with our listeners?
Well, Ralph, first of all, thank you so much for allowing me to be with your audience today, and also for helping me spread the word about collaborative care. I guess in closing, I'd like to share that my thoughts that vibrant health is a team sport. It really requires the input of a well-coordinated team of both medical and alternative providers. And these are folks who are focused on seeing health as a function of lifestyle, right? That it's good health or bad health is not an event that strikes you from out of the blue, but it's a result of your habits and your lifestyle. And Ralph, I encourage patients to seek out care in multidisciplinary settings, and I do encourage physicians to learn how to better work together in the very best interests of their patients.
Mm-hmm. Yeah, that's words of wisdom from Dr. Mark Sanna, who is a healthcare entrepreneur He's built several successful businesses helping medical professionals as well as alternative healthcare providers to break down the walls of the traditional silos that hamper effective collaboration. Dr. Sanna has helped providers form integrated healthcare teams and networks in the U.S. as well as internationally. So, again, if you'd like to find out more about his coaching services and this new way of looking at healthcare, mybreakthrough.com is the website. That's mybreakthrough.com. Dr. Sanna, thank you so much for being on Rebelpreneur Radio today. I really appreciate it.
Thank you.
You've been listening to Rebelpreneur Radio with Ralph Brogden. Download the show notes and much more at rebelpreneur.com.